Good afternoon and welcome everybody to the Colorado Fruit and Vegetable Growers Association Lunch and Learn webinar. And this series is the 6 weeks to improve resiliency for farmers. Today's webinar session is hands-on tools for stress management. Please join us for 3 additional sessions Thursdays from 12:10 to 12:40 through May the 14th. See more details at coloradoproduce.org/COVID-19. I'm Adrian Card with Colorado State University Extension and board member of the Colorado Fruit and Vegetable Growers Association. I'll be your host for today's webinar. Today we'll equip you with a toolbox of practical tools to help you manage stress in a daily basis. CFEGA is the go-to resource for Colorado's fresh fruit and vegetable farmers. We connect Colorado growers with industry, government, academia, and consumers to strengthen and expand Colorado fresh fruit and vegetable production. Learn more at coloradoproduce.org and follow CFEGA on Facebook and Instagram. Want to make you aware that some Zoom webinars have been hacked recently. If we have that occur, I will attempt to remove that disruption as quickly as possible. And if that's not possible, I will end the meeting and we'll do our best to reconvene. So we've got that contingency in place, and if it happens, hope it doesn't, we'll do our best to manage it. You'll find a Q&A box in your Zoom window. You can mouse around till that appears, and you can use that to answer questions that Lauren will have for you during the presentation. Zoom is very customizable in terms of viewing. Please resize it to fit the desired configuration in your viewing monitor. And we're also going to conduct a few polls with you today to get feedback and help Lauren understand where you're at in terms of how you're working with stress in your life. The recording today will not be, the polls will not be visible in today's recording, but the recording will be posted to that same website I referenced earlier, coloradoproduce.org/COVID-19. Our presenter today is Lauren Ziegler. She began teaching mindfulness and meditation in 2012. She's a leader in the Center for Mindfulness at Colorado State University. Lauren holds a degree in psychology from the University of Minnesota with an emphasis in mindfulness-based stress reduction. She has an advanced formal and clinical training and is certified with the International Association of Yoga Therapists and has expertise in working with spinal decompression, chronic pain management, and anxiety. Lauren is a speaker and educator, leading over 100,000 people in guided meditation for stress reduction, relaxation, and deep sleep. She provides a blend of education and practical experiential tools to show you how to use them as needed to feel better, to think better, and work better. Lauren, thanks for being with us today. We'll pass over to you.
All right, a pleasure to be here. Thank you. Hi, everyone. Welcome. We are going to dive into today's presentation. And before we begin, I would love to just do a quick review of what we did last week, which was a special kind of breathing. So just to fully arrive here and get ready for this quick 30 minutes, which will be jam-packed with lots of tools, let's take a few deep breaths to settle in fully. So you kind of let your shoulders drop down, and then breathe into your abdomen. See if you can expand your belly below your rib cage. And then breathe all the way out. See if you can breathe out a little bit more. Relax your belly, another full breath. Okay. So welcome to today, hands-on tools for stress management. And I'm really glad you're here. There are some useful things in store. Last week, we talked about the body garage, which was what I was calling a kind of a sense of what you're doing with your body throughout the day. So we talked a lot about body mechanics and ergonomics, and then the diaphragm breathing, which we just did right now, as well as interoception, which is kind of an inner inventory of scanning around your body. So a question that I have for you as we begin this week's content is, how much stress have you experienced in the last year? A little amount, a moderate amount, or a high amount of stress?
As we might guess, everyone is experiencing at least a moderate amount of stress here.
Yeah. Is there anybody that's experiencing relatively little?
No.
No. Yeah. I wonder if we were in a different time than what's going on right now, if we might have that. But usually there's not that many people who have little stress, right? We're all hanging out in the moderate or high amount of stress. So it looks pretty even there. Okay. All right. Thank you for your answers. I raise my hand to the high amount of stress category. And we're going to come back to that in a moment. But let's talk about hands-on tools for stress management. There is a tool that I want to share with you that I'm really excited about. It's called the biofeedback tool to release cortisol. So it has a physiological effect of releasing the cortisol stress hormone in the body. We're also going to talk about how to make stress an asset, and then more hands-on tools that I have for you. So this guy, Dr. Dean Ornish, is the first doctor to have created a program that has been scientifically proven to help reverse heart disease. So he's actually working with things like mindfulness and diet and exercise only. And so within the protocol of mindfulness tools that he uses this cortisol release one. So this has been studied over the course of many, many years and shown to be very reliable in reducing people's experience of stress. And so we're going to do it right now. I am going to toggle out of this so you can see me. And I'll demonstrate more visually for you. So if you can, sit comfortably. And all you need for this is a chair and a place to sit in your own hands. So it's a low-tech biofeedback tool. Please take your right hand and bring it up to your hairline, just below your left ear. So you start at your hairline, and what we're really doing is a self-massage, but in a really specific way. So start to try to grab, you make your hand a little bit like a claw, and almost try to grab some of those muscles and pull them away. Be careful not to dig into your neck bones or spine, but you're getting close to there, and then use your whole hand and sort of peel away the muscles. Grab them and pull them and peel them away from your spine as you work your way down. So we have a lot of residual stress hormones in our body, and they just kind of stay around in there. This is a way to tell our body, put it out, bring it out that way. So we're going down the arm, start to move into the fleshy part of your arm, and really firmly to make it effective. So it should feel kind of peppery. You're really grabbing those muscles. Work all the way down to the edge of your shoulder, and then start to grab the muscles of your arm as you work your way down. And just as long as it's strong, as long as you're grabbing, you can go anywhere you feel around your arm, down to your elbow. So if you have like a tendonitis thing going on, you might hang out in that area a little bit longer. And then go down your forearm, all the way to your wrist, pretty firmly again. And then what you're gonna do when you get to your hand is massage every single finger, but it's almost like you're trying to take off sticky glue. Each finger. And then give that hand a shake. And then place that hand back down somewhere on your lap. Close your eyes for a moment and feel the difference between your left arm and your right arm. It might feel warmer, just a little more easeful, a little lighter. And again, this isn't just for your arm's sake, but for actually releasing the stress hormone called cortisol. So we're saying, go this way. And so let's do the other side. Bonus if you regulate your breathing during this. So you can think about taking smooth breaths in and out as you start to work your way down. Starting at your hairline, down the side of your neck, to the fleshy part of your arm, and then work your way down. And then once you get down to your wrist, you're gonna imagine there's sticky glue you're trying to get off of each of your fingers and your whole hand. And then give that hand a shake and place it down. Place your arm down and notice. So your arms might feel just a little more vibrant. You can feel sometimes a little bit more sensation, a little warmth or tingling even. Maybe some more ease in your shoulder. So something so simple like that is a really powerful biofeedback tool. And it does literally change the way that your body metabolizes these stress hormones over time. It's a biofeedback tool because you're telling your biology, move the stress out, and you get better and better at that. So notice how you feel and know that you have that tool to use anytime. Jump back in here. I've also included some instructions in the presentation. So what we just did, and you can feel free to review these in the replay. Second question I have for you is, do you believe that stress is harmful for your health? Yes or no?
Looking like mostly yes here.
Mostly yes?
Yeah.
Mm-hmm.
Yeah.
Because stress, we're told enhances, it can promote illness, it can promote other health complications. So that's really common. We're told that a lot, and of course we think that, but I also kind of want to change your mind on that today. So we'll talk about a Harvard study on this, and 43% of the people who saw stress as harmful for their health had an increased risk of dying. And they followed 30,000 US participants over the course of 8 years. So let me tell you a little bit more about this. They followed these people, and then they asked them those same questions. How much stress have you had in the last year? And do you believe stress is harmful for your health? And then they used public death records to see who died. It was over the course of 8 years. So there's bad news and there's good news. In that the previous, like in those the studies where they followed the people that had the 43% increase risk of dying, that was only true for people who believed stress was harmful for their health. So people who did not believe it was harmful for their health were least likely to die. And that's even compared to the people who experienced relatively little stress. This is so interesting because it points to something about our belief about stress and that how we think about stress matters. So in this study, which Kelly McGonigal talks about in her TED Talk, they put people through a social stress test, which is basically you had to be in front of like an interview style presentation in front of panelists who were trained to give you non-approving looks and zero feedback. So when you were sufficiently demoralized, then you were subjected to a surprise math test in front of a panel who was, unbeknownst to you, trained to harass you during the math test. So if you were in this situation, you'd probably be pretty stressed out. Your heart might be pounding. You might be sweating. Your breathing may be more rapid. And usually we experience these physical symptoms as anxiety or signs that we're not coping very well with the pressures. But what if instead you viewed these signs as helpful? So your pounding heart is preparing you for action. Rapid breathing, no problem. You're getting more oxygen to your brain. So this is exactly what some participants were taught in the study. They were taught to see their stress response as helpful. And they were told, what if you viewed those physical symptoms instead as your body energizing you and preparing you to meet the challenge? And so participants who learned to view the stress response as helpful for their performance, well, of course, they were less stressed out, less anxious, and more confident. But I think most interestingly that their physical stress response actually changed. So in a normal stress response, blood vessels constrict quite a bit. And this is why chronic stress is often related to cardiac and heart disease. However, the participants that were trained in this different way of looking at stress, their blood vessels did not constrict. In fact, they were relaxed. And so they were relaxed and their heart was still pounding. But this researcher, Kelly McGonigal, says that the cardiovascular profile of those people actually looked a lot like when we're in a state of joy or courage. So this one biological difference is huge. And it's really what the new science of stress is revealing, that how you think about stress matters. So what if instead of getting rid of the stress, we try to be better at stress? And it's a different way of thinking about it, but the studies show that it's so profound in the actual physical result that it has. So hopefully the next time that you're feeling, I think 55% of you said you have a lot of stress. So hopefully the next time that you're feeling that, you can think to yourself, this is my body helping me rise to the challenge. And when you view stress in that way, your body believes you. And a diamond is just a piece of charcoal that handled stress exceptionally well. So I'm wondering from you, in a stressful moment, which symptoms do you most frequently notice? And can you imagine, as a follow-up question, feel free to type into the Q&A, can you imagine feeling one of these symptoms and having that perspective? My heart is beating because it's bringing more energy into my body so that I can handle this. So I'm seeing a mix. Other, okay, quite a bit of people have other. Please tell me more in the Q&A. Tell me more what symptoms you frequently notice. We get kind of used to our own stress response, but I think it's helpful to find modulation in it and find out what really specifically is going on. And I'm curious. Feel free to share. And we're going to dive into some more hands-on tools. I'm excited to teach you these things because there are the most powerful things and the most simple things. However, for this one, we won't do it together right now because you likely don't have a pool noodle nearby. But for this one, you will need a swim noodle. I just get them at the dollar store and cut them in half. You know, it's about 50 cents. And if you have a pool noodle, you can do this really, really effective upper back, neck, and shoulder massage, which also hydrates the fascia and layers around those muscles. So it reverses the effects of the forward bending position that we do a lot in our day, probably in our work. Okay, I'm seeing some answers. Stress, headache, skull. Okay. Yeah. I wonder if that's with acute stress or with chronic stress. That's a nuance to think about with this question, right? Where does it show up immediately when you're in a very stressful acute moment? And where is it stored long term? So just something to think about. Oh, Amy says, I do this a lot with the foam roller. Good. Okay. So the noodle is a little bit different, and I'll tell you why. The foam roller is great too, but the noodle has a texture such that it's really soft. So you actually get some pressure, but it's not much. It's like the world's tiniest little back bend. But what you'll do is place the noodle on your spine with the bottom end between your shoulder blades and the top end at the crown of your head. And then your head will be on the noodle as you lie down. Bend your knees, place your feet on the floor. Rest your arms by the side of your body. See how this is a little bit sort of like a back bend. You have something back behind you. And then what you need to do is just relax into it. You sink into the noodle for about 1 minute. You relax your shoulders and your chest. And then there are a couple of other variations, and I'll just skim through these because we're not doing them together right now, but come back and look at these instructions so you can do it when you have a pool noodle. It's really, really helpful, especially if you've been doing some hard work or even work at the computer, to do this as little breaks throughout your day. You'll place the noodle on the inside of your shoulder blade for this one. So variation number 2, the bottom end of the noodle lines up with the bottom of your shoulder blades. The top end sticks out to the side of your head, shown in the second picture here. Your head is actually on the ground, but it's a little bit off to the side. This gets into that sweet spot right beneath the shoulder blade. And then you do the same thing, just rest into that and allow the muscles and tissues in your upper back to release into that noodle. And then the last variation is that you place the noodle horizontally across your upper back so that it rests along your shoulder blades. And then, so it's about like a T shape. And then you relax here for 1 to 2 minutes. So what this is doing, the noodle in 3 different ways, is getting at a lot of those patterns of holding tension that we have in the upper back. So try it out. This is one of my favorites. All right, so we're moving along to the twist. And this is something you can do right now. What you need is a chair. All you need is a chair. And if you have a history of spinal disc injuries, then you can just proceed with caution. If you have a current spinal disc injury, then I would say don't do this one right now. But you'll sit upright and then plant your feet evenly on the floor. So press your feet into the floor as if you're about to stand up. And then relax your legs a little bit, but maintain that upright posture. So feel free to do this along with right now. Now on your in-breath, lengthen your upper body, like you're just elongating your spine up towards the sky. And then on your out breath, turn your torso to the right side. Bring your right arm to the back of the chair, your left arm on your front right thigh. Stay for about 6 breaths. So every time that you breathe in, you can think of sitting up taller. Every time you breathe out, think of dropping your shoulders. Your head can kind of just go along with the twist. Mostly you're twisting from your belly, ribs, and chest. Stay for a couple of more breaths. Notice how you can use your arms as leverage to get more twist. Notice how you can pop your chest forward a little bit more to get the twist in a little bit of a different area between your shoulder blades. Press your feet and legs into the floor and then come back to the center. Relax your abdomen and we'll do the other side. So you have your feet planted on the floor, press them into the ground. Sit up tall, breathe in. And then as you breathe out, twist over to your left side. Bring your right hand opposite, kind of the outside of your left thigh here. The left hand back onto the back of your chair. Grab on somewhere. And then every time you breathe in, you're sitting up tall, lifting. Every time you breathe out, you're twisting, dropping your shoulders. So you're involved here. Stay involved. At each breath, you're getting taller and dropping your shoulders. Stay for another couple of breaths. And then come on back out when you're ready. Where do you hold stress in your body? So ask, which symptoms do you most frequently notice? Now, where do you hold stress in your body? You can answer it either, acute stress or chronic stress, whatever comes up for you. Where's your area that you know? And I ask this because next week we're going into some really, similarly, really practical tools, these ones that you can use while you're working throughout the day. I'm going to include a lot of them, and it's helpful to know what you need. Neck and shoulders. Okay, that's the biggest one. Stomach. Back and hips. All right. So some neck and shoulder stuff. Yep. The noodle for sure. This one can help lengthen and stretch your entire back, including your upper back. And so if you'd like, you can do this right now, sitting in a chair. Again, if you have a current spinal disc injury, then you may be able to do this. This is a safe movement, but just proceed with caution, depending on your injury. So you're going into a forward bend flexion. Sit to the front of your chair with your feet evenly on the ground, and then press your legs and feet into the ground again. So your spine and core engages upright a little bit. Then relax, but stay upright. Then as you breathe in, lengthen your spine. As you breathe out, bend forward from your hips and lean your elbows forward onto your thighs and pause. So you have a straightish back. So if you have discomfort in your back, you may stay here, or you may start to explore bringing your elbows down a little bit lower. You may proceed further by sliding your hands down or onto the shin or the ground. So you are in a forward bend position. Keep pressing into the ground with your feet slightly. Relax your back. Then to come out safely, press your elbows into your thighs one at a time, and then prop yourself back up. Bring your body back upright. One of my favorite reset tools to use to just reset some of that stress. This one I'm going to go through because you don't have a tennis ball and a sock right now, but when you do, you can do a really nice upper back and neck and shoulder massage using this. So you would lean into the tennis ball and you just kind of make your way around. You target areas and slopes of your shoulders that feel good. Same thing with the tennis ball. You can use it specifically for your feet. And it's really not recommended if you have severe plantar fasciitis, but it's definitely really useful if you have mild plantar fasciitis or anything going on in your feet like that. But it also affects even the mobility and flexibility of legs and hips to massage your feet this way. So if you have a lacrosse ball or a tennis ball, with or without the sock, you can do it this way. You put it in front of your foot, and then you do sort of where your heel is, and then you do the middle of your foot. All right. So the homework that I have for you is more resources coming your way. So keep an eye out for your email. If you registered for this webinar, you will be getting a mindfulness-based stress reduction recording from me. And that is a really useful thing to use to start doing a little bit of mindfulness practice. 3 minutes a day. 3 minutes a day is what I would recommend. And you can use a regulated breathing that we've done. You can use the diaphragm breathing that we've done. Or you can use these tools to help prepare you and then sit for a few minutes of regulated breathing. So did you learn anything new? And will you use those tools? Feel free to type in any questions that you have into the Q&A box. And
Lauren, do you see the one about a future webinar suggestion on insomnia?
Yes, we're getting to insomnia in about 2 weeks. Next time is going to be some more practical tools that you can use at work, a little bit more movement. I've got about 4 or 5 more things for you for movement-wise, and some breath work, and then we're going into insomnia for a full session on insomnia. Make sure you join that one. I'm going to teach my favorite breath work that really helps me. I even used it last night to fall asleep. Wonderful. I'm glad that you have learned something new. Keep an eye out for that email so that you can practice this week. And then feel free to be in touch with me if you have any questions. So I challenge you in the next 48 hours to use something that you learned. Maybe right even after this webinar, just refresh yourself and use one of those things that we did together so that you remember it and have it as a tool in your toolbox that you can just go and grab when you need it. So it's important to manage the stress, but it's also important to realize that you can handle the stress. You can handle a lot more than you realize. You are so much more resilient than you realize. and having an attitude that this is helpful. The stress response is helpful, and it's my body telling me and energizing me for this situation will help you greatly in how you manage stress as well. All right. Thank you, Adrian.
Great, Lauren. Thank you so much. Everybody register for exercises during work next Thursday, April the 30th, same time, 12:10 to 12:40. And we look forward to seeing you next week, and look for this recording posted to coloradoproduce.org/COVID-19. Thank you.